My name is Dr. Katie Fitton. I am the graduating chief fellow from Ascension Genesys Hospital in Grand Blanc, Michigan. I have the pleasure of submitting to you my application for the Early Career Professional Development Scholarship with CHEST. There are 3 key questions that the committee has asked me to answer, and I'll do my best to answer them. Thank you in advance for taking the time to listen and to just get to know me a little bit. The first question the committee asked is, what do you think are the main professional challenges that you will face after finishing training? I think there are probably 3 key things that are going to be the biggest challenges that I will face. The first one is not unique to a fellow or a graduating fellow. Like all pulmonary critical care professionals, our specialty is currently under a microscope. That makes practicing evidence-based medicine in the face of COVID-19 extraordinarily difficult. As if I don't have enough on my plate going through the learning curve and transition that is being a new attending, I get to add a pandemic in which everyone on Facebook is suddenly a scientist and expert in pulmonary critical care on top of it. For instance, has there even been a week that's gone by where somebody hasn't asked why their loved one isn't on Plaquenil? I need to be up to date on the latest information and latest research in order to combat the misunderstanding that's currently present in the general culture. The next major challenge is involving around what I'm doing right now, and that is learning unique ways to put myself out there and grow in my career. Networking has suddenly turned into YouTube videos about myself and virtual chat groups about the latest research. The last challenge I think I'm going to face focuses a lot on teaching. I am going to talk about this a little bit more in my upcoming questions, but the transition from being a fellow in training to teacher is a challenge all graduating fellows need to face. Although I'm used to teaching residents, the added stress of being an attending and one who will often need to teach in this virtual world will be extremely difficult. With limited resources, a pandemic makes teaching new physicians very challenging as I try to keep them safe and secondly, help them learn autonomy. Next question that the committee asked is, how do I think this scholarship will help me in facing these challenges? First of all, I think staying up to date on evidence-based medicine will automatically be easier if I'm involved in and working with a society like CHEST. For example, at the beginning of the pandemic, I was a regular at every webinar that CHEST provided. It gave me the opportunity to see how other healthcare providers were practicing medicine in a completely unprecedented situation. Thursday afternoons, my husband always knew where to find me in my office, talking and discussing things at the lectures on my computer. The second way that the scholarship will help me face these challenges will be by giving me opportunities to just network. I look forward to learning about more leadership opportunities within CHEST and the CHEST Foundation. I look forward to honing my skills as a young pulmonary critical care physician with the up-and-coming CHEST meeting and the live learning course I'll be able to attend as well. I've already attended the CHEST ultrasound course. Maybe I'll be able to attend the advanced course in the future. And the last way I think this scholarship will help me face these challenges is encourage new and innovative ways to teach. I often follow CHEST and other pulmonary critical care physicians, for example, on Twitter. And I remember in April, another physician was talking about ways to keep the morale up for her residents at the beginning of the pandemic. She would talk about how they would use live streaming feed of pandas in the call room that the residents would watch on breaks. It would always make her residents smile and laugh. This gave me the idea to look for ways to make my residents smile and laugh and remember life outside of the COVID wards. So we started doing weekly Chick-fil-A breaks, which would always make them smile. I started a communal PPE pile for them as well. So when they ran out of hospital PPE, we were always able to stay safe. My OB resident, who I'm almost 100% sure coined the phrase tummy time in conjunction with proning long before that was a meme, brought in bright pink gowns from the office, just like you would expect from an OB office. We could then be spotted anywhere in these patients' rooms, on the floor, and it would always make the nurses smile and the patients smile to be seeing us wear bright pink gowns. I wouldn't have had this idea had I not been following other CHEST physicians on Twitter. The next question that the committee asked me to answer is, how can CHEST support my transition from trainee to early career professional? And first of all, I'd like to say that I think this is something that CHEST excels at just in general. When I was a fellow, I had the opportunity to do the fellow scholarship and training course at CHEST 2018. This was truly an eye-opening experience for me as I had no idea what kind of opportunities were available. Trainee committees, fellow opportunities, and talks that trainees give are something that I had wished that I had known about sooner. There was one in particular, I found my way to the trainee lounge during a talk about imposter syndrome, and I was amazed to hear that this is an actual phenomenon that most trainees experience. The feeling of inadequacy is something common among physicians throughout different points in their career. It turns out, after all, that it was an accident or luck that I'm here. Afterwards, this is something I brought back with me from chest to my residents, and they've all commented about how much they've appreciated learning about this as well. If chest can continue to walk with new attendings like myself through networking and mentorship, I definitely think that would be the most helpful support for my transition. Practically, even meeting with and talking with other new attendings would be beneficial. I look forward to hearing about future lectures, learning by doing, and opportunities to meet other people with interests the same as myself. So to summarize, I just want to thank you all for taking the time to listen to me and to get to know me. I appreciate that there will be a lot of challenges in the years to come, and I hope I have the opportunity to learn with you all in the future, especially now as I make this unique transition from fellow to attending.